I'd like to welcome everyone to the Forum Speaker Series Lunch. Thank you to Express Employment Professionals for sponsoring today's forum. It's fantastic to see this room filled with everybody in business and community and doing life together. Appreciate it. This month of February is a busy time with the legislature in a short session here and our city facing tough challenges on many fronts. The Salem Chamber remains committed to being on the front lines at City Hall and the state capitol as we seek partnership and collaboration in policy-setting efforts ahead of us. If you're an elected official and you're here with us today, would you please stand so that we can recognize you for your service? If you're on the Chamber Board, would you please stand? Thank you for participating in how you do. And then if you are a past president of the Chamber of Commerce, would you please stand so that we can recognize you? And then would everybody please stand for Jerry Frank? You know, I mean, I'm just going to tell you something. If you ever want to think about Jerry Frank's impact on this community, just think about if we didn't have Jerry Frank and start to subtract all the things that we would not have in this community. And that's when you begin to realize the impact that this man has had. And so I don't think that we should ever not take the opportunity to stand and clap for him. So Jerry, thank you again for everything that you've done for us. At our head table today, we have our speaker, Mrs. Cheryl Nestor Wolfe. She's the president and CEO of Salem Health. We have Patricia Callahan-Bowman, who's the owner of Express Employment. Matt Massera, who is the executive director of Be Bold Street Ministries. And in the blue down there, Josh Lair, who is the president. Wait, I said Matt. Matt, you're the executive director. I'm sorry. Josh, you're the president. You guys can fight over those titles later. I think Josh would win, but... And then we have Tom Hofford, CEO of the Salem Chamber. I'm TJ Sullivan. I'm the president of the board and a partner at Huggins Insurance. This Wednesday, February 12th, will be a pivotal State of the City luncheon hosted by joint partners of the Salem Area Chamber of Commerce, our Downtown Rotary, and Salem City Club. Our mayor, Chuck Bennett, his address will be a can't-miss programming. I know all of you you guys are all watching CCTV on Monday nights, and this is going to be like that unplugged, and so it's going to be great. Please complete your lunch reservations today by contacting the Salem Chamber's front office to lock in your attendance. The luncheon is from 11:30 a.m. to 1 p.m. at the Salem Convention Center. Now please rise for the presentation of our national anthem by the Willamette Master Chorus. They will have two performances of Handel's Messiah on February 22nd and 23rd, 3 p.m. both days at Hudson Hall. Please remain standing for our invocation by Bry Taylor Campos with Windermere Pacific West Properties.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the
Absolutely beautiful. Will you pray with me? Father, thank you for letting us gather here for lunch today. We want to thank you for the people that took the time to prepare this meal and prepare this time together for us. May we use this time to grow closer together as a community. We thank you for our beautiful city and our amazing state, and may we never take this for granted. We ask that you guide and direct all of our leaders, Lord, those seen and unseen. May they do your will. Father, we also ask that you give our leaders the courage so even that when it's hard, they would continue to boldly represent their constituents' needs, and we ask that you give each of them a servant's heart. We ask for your blessing and protection for all of those who serve and protect us, from our city's first responders to our troops overseas. Lord, please comfort the brokenhearted, guide those who are lost, and bless this city. You are the God of this city, and we trust in you. In Jesus' name, amen.
You might be looking at the head table going, it's kind of strange. We've got the hope dealers here with the CEO of the Salem Hospital. It's kind of a weird head table, kind of unusual. But in fact, it's actually perfect. You see, because the hope dealers and the Salem Hospital are both looking for broken people in our community to help and to take care of. And it's important to understand your role and how important you are to the work that they do. See, Cheryl, in her business, she gets clients of all shapes and sizes. Some of them come in with Medicare, some of them come in with Medicaid, some of them come in with no insurance at all, some of them come in with insurance that they get through the state of Oregon. And in all those scenarios, they do not compensate Cheryl for what she needs to provide her service to them. And so she relies on a variety of sources, but in fact, she relies a lot on you and your business and the economic security that your business has to be able to provide health insurance to your employees. Or if you do not provide it and you have purchased it indirect or directly for your family, then she relies on your ability to have that economic security in your family in order to provide that service. And without you doing that, you make her job a lot harder. And she doesn't have the ability to invest in her business, which provides for the livability of our community. So what you do in your business matters to what she does in hers, and it's super important for the livability of our community. And the same thing with Josh and Matt. The work that you do provides economic security for your family so that you can give and be generous to the nonprofits in our area, like Be Bold Ministries. And the work that they do is the work that none of us would raise our hands and say we want to do. We want to get that call at 2 a.m. to go find somebody who's passed out in front of a business or in front of your home, or to find somebody who's struggling with a mental health issue and be confronted. That's hard work, and you have to have a certain set of life circumstances that would lead you to a point where you say, you know what, sign me up for that job. But because they get supported by people in our community who have economic security, they're able to get out and do those hard things. And they are making a difference in our downtown. It's hard. This is a huge problem. But these guys are on the front line of sacrificing themselves and their sleep patterns and their comfort zones to be out and to help the businesses and the residents in our downtown core especially. If you've had a chance to call these guys and ask for their help, would you raise your hand? I just want to get a feel for how many people that is, okay? Thank you guys for that, by the way. And I'm going to just introduce them here in just a second, but I just want to just add to, in both situations, it relies on economic security for families and businesses to be able to support these two organizations. And there's one organization that when they wake up every day, they go to work thinking about how to improve the economic security of our area, and that's the Salem Chamber of Commerce. We're the leading organization in that. And sometimes we lose track of that when we get together because this doesn't feel like work right now, right? This feels like taking a break out of our day. But in fact, what we're doing when we go to work and when we come here is that we're working to promote the economic security of our area. And that's helping to support these two fine organizations. So with that, I've known Matt and Josh for a while, and every time I'm around them, I'm inspired, and we should be recognizing them with the Spirit of Salem Award, because being a part of Salem means that you're a volunteer and that you're a servant, and these two guys represent it very well. And so I'd like to introduce them, have them come up, accept the Spirit of Salem Award, and tell you a little bit about what they do. Boys?
Well, I guess we got to start off this way. So we absolutely know who gets credit for this, and it's God, because He rescued me from 27 years in the drug world. My dad was a gang leader in the Latin Kings, and so I have 27 years of experiential knowledge to be able to reach out to our neighbors who are battling with homelessness, gang life, drug addiction, criminal behaviors. But I'm no longer that man. I'm a new creation, and we are a Christ-centered nonprofit organization. And advocacy for us is not to advocate for somebody to stay in the situation they're in. And the commitment for us is that as we walk side by side with our dear neighbors on the street, that the commitment for us is we are absolutely going to and do suffer alongside them as they get drawn out of the life that they've been exposed to. And I guess I could just share a little bit too. In the last 4.5 years, we've seen over 450 folks that were battling with the same behaviors that we had, drawn out of those lives. Some of them, specifically one mom had her 5 kids at the homeless camp in Wallace. And when we met her, she was covered in MRSA and drug addicted. And we're 2.5 years down the road as we've been able to help provide the needs. As she got into her place, we've seen her come to know Jesus Christ as her personal Lord and Savior. She now manages one of our community partners, has all of her children back, has her own home, and is a business manager in our city. And there's so many stories that we can tell you like that. These are folks that we can absolutely introduce you to, so it's not just a story and there's no face to the story. Her name is Jessica, and there's hundreds of folks that we can introduce you to, the same kind of stories. But as I said, we're a Christ-centered nonprofit. We absolutely want to see people saved, discipled, baptized, and become the one sent. And that's what we get to do all week long, is reach out to our neighbors. So we're on the streets. We get to do a lot with a lot of the public entities, secular nonprofits, providing needs for folks within, New Options, Her Place, Marion County Drug and Alcohol, ABH, PCC, from time to time clients at the Salem Hospital. But if I were to lay out everything that the Lord lets us be a part of in our city, it would be hours and hours. But it's just an amazing privilege and honor to be here with each one of you today. And, everything we do, today what I get to do is not merely be concerned about my own affairs, but the affairs of others. And to see others is more important than myself. And that's a commitment for us. And that's when selfless love comes into play, which is the same love that showed up in a time and space for us.
This makes no sense outside of God. Like TJ said, the people sitting up here, I know I was wondering why we were sitting up here, and I'm sure some of you guys were too. But we do what we do because Christ first loved us, and so we get to do the same thing, and that's share the love of Jesus Christ with our friends and neighbors on the streets. We are living proof that it's possible, that the folks that are out here on the streets in front of some of your guys' businesses, when you guys try to start your day, that used to be us. And that's no longer a part of our story, and our story consists of being able to go back and helping the same people that we used to be. So please don't give up hope. I know that it's a huge impact on your guys' businesses and the things that go on within Marion County as a whole, but we're here to step alongside you guys and them to do something different. So we're super thankful, and man, go Salem, go Marion County, huh?
I was going to make a joke about Cheryl comparing tattoos with them later, but I'm not going to make that joke. So, Patricia Bowman Callahan, somebody who I've had the pleasure of serving on boards with, and I'm always Cheryl's one of those people who knows how to wait until everything that has been said, and then she says what needs to be said. And I've really appreciated working with her. We've used her business, and she brings the same professionalism to her business that she brings to a boardroom. And I would highly encourage you, if you're looking for somebody to add to your team, and right now I know that we're all looking for good people to find and fill holes in our businesses, and Patricia can be a key resource for you. Because they are locally owned and they live and work in this community and have a vested interest in its success, in addition to staffing service, the Express team is actively involved with a wide variety of causes and organizations that help strengthen Salem. The Salem office is owned by Patricia. In addition, the Salem team consists of 10 additional team members who are dedicated to getting 1 million people back to work. That's a lot of people. The Salem location specializes in professional, light industrial, and office services staffing. Patricia joined Express in 1980 and owns the Salem franchise. She is certified through the National Association of Personnel Services as a certified temporary staffing specialist, as well as holding the designation of certified staffing professional through the American Staffing Association. That's a lot of staffings in one sentence. I'm just going to say that was like 6. Both certifications and designations of knowledge are continued education in the staffing industry. Patricia purchased the Salem Express office in 2000, and she has over 21 years of experience in human resources, employee management, staffing, and operations. She has served on the boards of directors for the Salem Area Chamber of Commerce, SEDCOR, the Rotary Club of Salem, and the local Workforce Investment Board. She's a founding board member of the Inspire Foundation and continues to serve on that board to this day. Help me welcome Ms. Patricia Callahan Bowman.
Thank you. That was a great introduction. I can sit down now, right? As TJ mentioned, we're a full-service staffing company, and we've always been a top provider of light industrial and manufacturing and skilled trades, but now we're ranked nationally. Express is ranked nationally in office services and professional, so we can provide whatever we need to provide for you. We also were awarded the clearly rated Best of Staffing Talent Award and the Best of Staffing Client Award, which is based on a satisfaction survey that goes out to all of our clients. So thank you, anybody who participated in that. Okay, so everybody in here knows the difference between blue-collar and white-collar workers. How about gray-collar workers? How many of you know about the gray-collar workers? I don't see anybody, so that's good. I have something to say. And it's not people that are, have white hair or are older. It is the workforce that you're going to be seeing as more information about as they divide out the different types of workforces and give statistics. And the gray-collar workers is a vast middle ground between the white-collar and the blue-collar worker. And they're likely to probably play a bigger piece in the economic future of our area. There are people like clergy, engineers, firefighters, military, non-physician healthcare providers, and I think you're going to be seeing, like I said, a lot more focus on that sector. I also have a white paper on that. If anybody's interested in knowing more about it, just let me know and I'll email it to you. The biggest decision that a leader makes involves people. The people determine if an organization will succeed or fail. The Express mission is to provide the opportunity for businesses to hire the right people to ensure success for them and the overall economy. And there's no better place to be than the connection that helps make that happen. Now it's my pleasure to introduce our speaker. And I was delighted when I found out that was who we were going to sponsor, as Salem Hospital does an amazing job in this community. Cheryl Nestor Wolfe came to Salem Health in 2007 as the Senior Vice President of Operations and Chief Nursing Officer. Salem Health includes Salem Hospital, West Valley Hospital, and the Salem Health Medical Group. Prior to her arrival in Salem, Nestor Wolfe was Vice President and Chief Nursing Officer at O'Connor Hospital in San Jose, California, and Chief Nurse Executive and VP for Nursing and Patient Care at St. Mary's Medical Center in San Francisco. Her early nursing career consists of nursing positions in hospitals in Virginia in psychiatry, pediatrics, and neonatal intensive care. A move to a community hospital from Monterey Peninsula, California in 1977 led her from a staff nurse in the hospital into oncology management and then into nursing administration. While serving as Chief Nursing Officer, Nestor Wolfe led the staff in achieving magnet status for Salem Hospital in 2010, and working with clinical leaders and specialty practice teams, a dormant magnet preparation process was revived, enlisting all the members of the healthcare system in that journey. Salem Hospital is currently engaged in preparation for its third magnet redesignation. Nestor Wolfe became Chief Operating Officer in 2010, taking charge of the day-to-day operations of the two-county hospital system with more than 4,000 employees. Since being named as President and CEO of Salem Hospital in November 2015, Salem Hospital has expanded from 454 beds to 494 beds. The Salem Medical Group has significantly expanded. The emergency department has undergone a transformation, and pending board approval, plans for a major campus expansion is anticipated. Nestor Wolfe has served on numerous boards, including the United Way of Mid-Willamette Valley, Northwest Organization for Nurse Executives, Nurse Week Advisory Board, Willamette Valley Community Health, and the Salem Area Chamber of Commerce. She currently serves as co-chair of the Quality Committee and as a director on the board of the Oregon Association of Hospitals and Healthcare Systems, and as a board member of Salem Area Boys and Girls Club and director of the Portland branch of the Federal Reserve Board. Please join me in welcoming our speaker.
Well, good afternoon. Thanks for having me today. You may hear a little Virginia in my voice. We'll see how this goes today on that. The topic today is keeping the community in community hospital, and I just want to spend a few minutes probably with things that you already know about the hospital and the importance in our community, but also with things that maybe you don't know about the hospital. Salem Health is your local healthcare system. We have been taking care of those who are sick and traumatized, who are in pain, or who have great joy in bringing new life into our community, and we've been doing this for over 120 years. The health system includes two hospitals, Salem Hospital and West Valley Hospital in Dallas, a number of specialty clinics, and now a majority of the community's primary health care providers. We are a level 2 trauma center. Level 2, there's 1, 2, and 3, 1 being the highest. And we are very close to a 1, but many of the subspecialties that are required for 1 we don't have, such as a pediatric neurosurgeon, as an example. We're currently licensed for 494 beds. As the largest private employer, our economic impact in the community is significant. We now have over 5,000 employees. We have 800 providers in our community that provide medical care that are on our active medical staff, and we have nearly 500 community volunteers. According to a report that was published in May of 2019 by Econ Northwest, the economic contribution of Salem Health is $1.35 billion. For the 5,000 people we employ, community jobs are linked directly to those. In other words, jobs that are necessary because of our employees. That's an additional 4,700 jobs in Marion County. Interesting, even though we are a nonprofit, we do pay taxes on many things, and we contribute to about $44 million. This is along with Santiam and Silverton in taxes in our local communities. So a pretty significant economic impact. This is a list of our board of trustees. I always like to include this in anything I do because the majority of the people on our board live and work right here. And we have a few experts from outside of the community to help supplement our knowledge. I like to say we don't have a rubber stamp board because we don't. We go in with our information, such as building the new beds that I'll talk about in a minute. And that board really makes sure that what we're doing is in the best interest of the community. We have the busiest emergency room at Salem Hospital between San Francisco and the Canadian border. Last year, we served more than 115,000 people in our emergency room. Our mission is to improve the health and well-being of the communities we serve. More than buildings or clinics, Salem Health is made up of providers and staff who are passionate about continuously improving high-quality care. They are also marked by compassion for people who are hurting. The employees of Salem Health have built a unique culture of care. We take care of you when you need us and sit beside you in church, at school meetings, and at sporting events. We are your neighbors and we are your friends. I'm immensely proud to be a part of this organization, both as a leader but also as a registered nurse, because the quality of care that we have in our community is outstanding. The organization consists of exceptional and dedicated clinicians and staff who provide nationally recognized quality care. These are just a few of the accolades that we have earned. I was told recently at one of our clinics open that I don't tell people about this. We're a little bit shy about it, but it was really good advice. And so I'm starting to include this when I talk to people. You heard a little bit about Magnet a few minutes ago. There is only 7% of the hospitals in this country that have that designation. We got our first designation in 2010. And we've redesignated now 2 other times. This is not a given that once you get it, you have it for life. So you have to go through the process every 4 years. So we've submitted our document for our 3rd redesignation. We're a top 50 cardiovascular hospital in the nation for the 3rd year in a row. Our employees have voted us a top Oregon workplace for the last 5 years. We've been a best hospital in the nation as recognized by U.S. News and World Report. We have specialty certifications that have extra additional work that we have to show and prove, our outcomes being one of those. We have it in joint, in lung care, in spine care, and we are in the process of adding stroke to our list. The Beacon Award for Excellence is an award that's probably less known, but this is a clinical excellence award for the care in all of our critical care areas. And as you can see, we've been redesignated and designated multiple times, so it wasn't just a fluke that one year we got it right. So it does mean that you have a hospital that provides the highest quality care. But most importantly, patients here do find compassion that can heal wounds, even those that you can't see. This is an organization really that our community can be proud to really call their own. Work in progress, great slide, right? We take our role as a community hospital very seriously. We know our community is growing and aging at a very rapid pace, and with this comes significant healthcare needs, not only at the hospital level, but also in outpatient and nursing facilities. In recent years, our inpatient census, so those people that are occupying an actual bed in our hospital, have continued to increase year over year. by looking at the data and trying to understand what's been going on, as well as looking at various population projects in our state, we know that in the very near future, we will have more patient needs than we have beds. We are committed, excuse me, we are committed as a nonprofit organization to return back to the community, excuse me, to return back to the community any money we make to keep quality health care local. So any profits that we make are moved right back into the community for care. So this is a picture of real construction. So we did get approval by the Board of Trustees, and the state did approve our additional 150 new beds. So the planning for this, making sure that you have enough money to pay for this, can take about 5 years or sometimes even longer, depending on the scope of the project that you're doing. So we've been working with our board, and as I said, I'm very pleased to announce that last month we actually broke ground. And this area is the site of the emergency room parking lot, the old parking lot. You can see we're not putting any cars in this at this point. Thanks to everyone who was able to attend the groundbreaking ceremony. It was a very exciting day for us because of all the years of study and planning to get us to this place. Once complete, the new building, which is on the east end of the current Building A, will be 7 stories, which is the same height as Building A, and house 5 floors of patient care, adding a total of 150 beds. We expect to see the first patient in the beds in July of 2022. We also don't expect to be full on day one. And so this is the need we've projected over the next 10 years. So this is a $210 million investment in our community. And the labor comes directly from the Mid-Willamette Valley, about 50% of that labor. $40 million has gone to local contractors and companies to help us build the community's new beds. And I would just add, these are your beds. They're not mine. They're not the Board of Trustees' beds. These are the community's beds. This map gives you a reference point as to where the new building will be located on campus. And again, as you can see, it's really located right where that lot was for the emergency room and the big sign that said emergency. So in that case, we did have to move the entrance to the emergency room, although if you park in the garage, you can still access the original emergency room entrance. So there is a way very easily to get from the garage there. But I think there's diagrams on your table about this. But we now have a building through the entrance through the other side of Building A, and we have set up valet. There's a guard station now on Oak Street, and we've set up valet to valet people's cars that need to go to the emergency room or in any kind of other distress. So this is what Building A looks like. Building A expansion, excuse me. This is a rendering of what it will look like once it's finished. And again, because of the growth in our community of people, but also because of the aging, there are higher demands for beds in our community to take care of people. And what we are hearing from Portland State that has done the population, in their Population Research Center, is the overall population is projected to increase by 30% over the next 20 years. So we are building for the future with our new beds. Actually, the older you are, the more likely you are to be in a hospital bed at some point as you get older. So that's pretty logical. People get older, they have more things going on with them. They become sicker. We try to manage people in the outpatient area as long as possible. It's a lower cost setting, but eventually a lot of older adults end up needing a bed in our facility. Those who are over age 60 utilize the emergency room as at a much higher rate than other populations. About 1 in 4 visits are between the ages of 60 to 79, and inside that cohort is about 1 in 2 is over 80. The health needs of our community are projected to increase drastically over the next 20 years, and we are already at capacity. So today, we have beds that are licensed in a particular way, so you can't put just any patient in those beds. It makes sense, like the NICU as an example, which is our neonatal intensive care. You can't put adults in there. So those are licensed beds, but those are beds that are dedicated by license to a specific population. And again, we added 40 more beds in 2018, and we still continue to see that growth and aging in the population really affect our ability to take care of people. So again, as a community hospital and as a nonprofit, we need the capacity to make sure we can serve the needs. So this was the opening of the Woodburn Clinic and Urgent Care. And as I said, we do more than just hospital beds. Since healthcare is so expensive, one of the ways that we try to give back to the community is increasing access to lower cost care, such as primary care and urgent care. In December, we opened the Woodburn Clinic, which is a 31,000 square foot building providing urgent care, primary care, and some specialty services to those who live in North Marion County. And we did an analysis of populations from that area that were coming to our emergency room that really didn't need emergency room care, and found that about 5,000 visits a year are coming from this area. So it really made sense to put a clinic there and an urgent care to help meet those needs. We also finalized our acquisition of the WVP Medical Group in the same month, doubling the number of lives served by our Salem Health Medical Group. We also partner with our local independent physicians, and these are providers that are not employed by the hospital, but again, in the spirit of lowering healthcare costs and creating great partnerships, we are in the process of developing 2 ambulatory surgery centers, and this is for outpatients. And so we have 2 of those joint ventures in the process. So the Salem Surgery Center is in partnership with Salem Clinic, Willamette ENT, and Willamette Urology. It's under construction at the former North Bank building, which is on the corner of Winter and Bellevue, and you can see the rendering here. We anticipate serving patients in about November of this year, and specialty surgeries include general, gynecological, urological, vascular, and ears, nose, and throat. So again, those patients that can have their procedures in an outpatient, it costs less to have it there than it does coming into the hospital. The second surgery center is in process right now, or in partnership with other physicians in our community, and the Willamette Surgery Center, which is across from Hope Orthopedics. We are in partnership with that group, which includes Hope Orthopedics, podiatrists, and general surgeons in that area. And so we are in the design phase on that. So people say, and I'm sure you get asked this thing, what keeps you up at night? They ask me that question. I go to staff meetings every year. I go to about 80 staff meetings just to keep the communication working in our organization, and I pretty much always get asked this question. And so just a small list of the things that worry me are things like reduction in what we get paid. That's pretty logical. You can understand that. We're still trying to keep care local, so it does put a lot of pressure on us. And it's coming fast and furious in this country, period. We just had a significant reduction in what government workers, what that insurance will pay us, and other payment changes are in the wind and will most likely happen. So it really, from a commercial payer perspective, it really starts to create some significant problems for us and for the community. Regulation hasn't decreased, it's just increasing all the time, and it comes with a cost. Again, a sicker and older population where care that's provided inside the hospital is the most expensive. So we're getting more, and the expense continues to mount of services inside the hospital. The age-old practice that we've had of cost shifting, which is where commercial insurances pay more to help support the things that aren't funded, is really not sustainable. And I don't think there's anybody who's been in healthcare for any length of time believes that it's sustainable. I don't know what the answer is. What your hospital is doing is looking for ways to reduce waste in our system and get more efficient, because if we can get more efficient, we can drive that cost down. Medicaid and Medicare, which do not cover what it costs, not the charge, but what it actually costs us to provide the care. And it's really reached a breaking point. We get 70% of our patients right now are Medicare and Medicaid. And then healthcare faces real threats from a number of areas as costs continue to rise, as patients are sicker than they used to be. And by the way, the millennials are sicker today than the baby boomer age is. And again, continuing to work through shifts in payer mix, and that's what this slide is about. So what you're seeing here is that the shift just in 10 years, and if you just look at a 1% shift from commercial to a public payer represents about a $10 million reduction. So it's pretty significant financial work that we do. And so what we do is we pay for all of our expenses, and then that bit that's left over, then we put it in the bank for large projects like the beds, or we have to spend a lot on capital. You can imagine the amount of equipment that we have. We spend anywhere from $50 to $65 million every single year just to replace equipment and bring us to the state of the art, so your physicians and your caregivers can take great care of you. We also have a community benefit pie chart up on the screen. This is what helps with our nonprofits status. We get about $133 million in care that we don't receive payment for. And again, that's our commitment to the community and to continue to take care of our community. So this is a little girl at Let's All Play Place. And even though we have children from our rehab center that go to this park on our campus to really experience how they can work with their particular disabilities, it's open to the public, and it was funded by our foundation. We know that much of what contributes to health really has nothing to do with a hospital. The zip code you live in makes a difference. So we know we don't do this work alone, and we partner with our community to make sure that we are present and part of the dialogue where we can talk about what we do that nobody else does in our community. So right today, all of the executives at community hospital, at your community hospital, most of the directors are on community boards. And last year, 80% of the departments in our hospital, the people in our hospital, volunteered in the community. I'm really proud that we have such great compassion and respect in our community. This is the new courtyard entrance into the emergency department. Our foundation will be fundraising for this. And it's really important that everyone supports the work. A lot of hospitals build a new building and you can't find the emergency room anymore. And you've been to those hospitals. You drive around and you're trying to find out where in the world do I park and how do I get in. So we've really made a big effort to open up the area so that when we move our emergency room back to the current entrance, we will have opened that area up and provided some respite space and prayer space for those who are in need. And we think it's going to be a great addition to the healing in our hospital. So this is a list of our foundation board. Jim Bauer is our new Chief Development Officer. He's waving his hand. And Alex Casebeer is the foundation president. And these are our foundation board members. They're all local and all may contact you about supporting the work. And again, I think we fill a place in the community and a need that nobody else fills. So this kind of is the concluding slide, which shows how A existing and A expansion meet together. So at the end of the day, it will look like one building, but there's enough difference in the two buildings that you won't feel like you just looked at a city block on the campus. So we're working hard to find that delicate balance between keeping health care affordable and local and reinvesting in our community and continuing to meet the many and varied needs of our patients so we can keep care local. I am really pleased we can offer world-class health care right here in your own backyard. Thank you for your time today. Questions?
Salem Health, Salem Hospital has really been excellent at reorganizing itself in the services it delivers. I think it's a lean program.
Yes.
You're also outsourcing that because you've gotten such recognition for it. Can you tell us about how you help other communities, including chamber members, to better run themselves?
Well, we belong to a national network of lean organizations, and so we host lean organizations or organizations that are thinking about becoming, using the lean methodology to increase your quality and reduce your cost. And so we host those, and then we have in the last couple of years expanded that to bringing in local businesses in our community and doing the same thing, because we think that we've been doing this for about 9 years. We have amazing results in the work that we've done and how we have worked hard to empower every single staff person in our hospital to do problem solving and waste reduction. And so we have been sharing that with our local community and really getting very positive praise on the work that we're doing. We're not doing it for the praise, we're doing it because we wanted a system that was tested that would really help us to think differently about the costs in healthcare.
We've heard a lot on the campaign trail about Medicare for all. Given the information that you just presented, what would Medicare for all mean for Salem Health? Is there a contingency plan for you?
Well, I think I'm awake every night. I didn't say those words. It's interesting. The cost of that is prohibitive. I mean, if you look at what we add to Oregon and the community, that $1.35 billion, that's not my number, that is a studied number in the state. When you look at that, once you start reducing the revenue in all of the hospitals, it will also have revenue reductions in your communities. It just will. It's an effect that the revenue has and the number of employees that you have. So we have run scenarios. going to be exceedingly difficult to continue to offer what we offer here locally with costs that don't cover, with reimbursement that doesn't cover the cost. And, you know, I'll be brave and say that while I understand that businesses' healthcare costs and premium costs are not sustainable, I get that. The tax will be more than that at the end of the day. So how do you balance the need to reduce costs, keep care local, have high quality costs with shrinking reimbursements? So we have run scenarios. It will be extremely difficult. Part of the reason that we're doing all the lean work now, honestly, is to make sure that we can take on any task that comes our way. But if this happens quickly, you will find hospitals in this country closing because they just won't be able to do it.
Cheryl, thank you for being here and for taking the hospital on an outward focus in our community. It's been great to see your leadership. Quick question. What was the total amount of your capital expansion, and how much did the gross receipts tax that the legislature passed, how much is that going to cost on top of that?
The gross receipts tax, I don't have that number in front of me, but the corporate tax, we don't pay corporate taxes, so it's a pass-through. So like our construction people, as they put their bids together, have just passed that tax right to us. So it's part of our overall building cost. And the $235 million that we'll be using for the new beds also includes a seismic upgrade of our current garage that doesn't meet current standards.
Back here, please. We don't have a number, though. Back here? Go ahead.
I just want to say a quick thank you for sending one of your staff to the Community Homeless Connect outreach. This year we get to do 2 days because we have a dedicated staff person from Salem Health. And then on a personal note, I 2 years ago had a heart attack, and it was less than an hour from 911 call to rolling into recovery. Thank you to Dr. Gandok, but also Salem Health. Less than an hour.
Yeah.
Can you go out to dinner for that amount of time? I had a stent and an angioplasty. So there's a reason they won that award.
Yeah, and they've worked really hard to get there too, I might add. It didn't just happen because we said, here's the national data. This is what we need to do in this time frame. Our physicians, our emergency room, all worked together to make sure that we could do just that, because time is muscle and your heart's a muscle. So we have to get in a really good period of time that's all been defined nationally in studies and make sure that happens. So thank you.
Hi, Cheryl. I'm here wearing 2 badges today. One is Salem Hospital physician. I'm a psychiatrist and the school board director. I just want to say thank you very much. Liliani Slama is here. Last year, they came to practically every school and ran a program to help increase awareness for suicide prevention.
Right.
Amount of dedicated outward thinking, much more than the building and the employee sector. You can imagine the care and the dedication they showed was just phenomenal, and I really want to say thank you. And the second part is, as a psychiatrist, I've been working in Salem Hospital since 2005. I've been serving as a psychiatrist for 31 years. This is the best hospital in my entire career in 3 countries, without a doubt. I have no hesitation in saying what you said is more than the dollars and cents. It's almost like a magnet for somebody to work and feel engaged. To me, that is one single factor makes a big difference in thing. So thank you very much for coming here and sharing this.
You're welcome, and I'll thank you on behalf of our entire team, because it takes everybody to make that happen. All right, thank you.
Well, I think this is a great example of great work and investment with very forward thought process. And Cheryl and her team, who I know are represented today at these 2 tables and even a few scattered throughout, you see Salem Health very present in this community. Like many of you showing up today, it is about conductivity and creating an ecosystem in which people are engaged. The addition of Jim Bauer at the foundation staff, Leilani and Bryce Peterson do just an incredible job in making sure that this business community is closely tied in with our largest private employer in town. So thank you to the Salem Health whole team for everything that you're doing. We'd like to recognize the great work of Patricia Callahan-Bowman, and to step up and sponsor is a great benefit to our organization and allows these programs to happen. But Patricia has been behind the scenes on our Inspire Foundation since day one. In fact, her and I were in Sofel Griggs' office signing that document many years ago, and Patricia has had probably a lot of opportunities to do other things, but continues to lead by example. And I know Kathy Moore on our staff and our team certainly appreciates that leadership and sponsorship today. We'd like you to pen into your calendars March 9th. That will be our next forum. And very, very unique presentation. We'll have Dr. Scott Campbell with us. And Dr. Campbell is the founder of Sylvie's Valley Ranch. And I'm sure a few of you in this audience have no idea what that is. I certainly didn't. But 140,000 acres in eastern Oregon, in between John Day and Burns. And it is a private-public partnership on the land. And they've got a golf course and some resort amenities, but it's largely a wildlife preserve and the opportunity for people to go out and see extremely rural environments and truly get away. The people coming in are largely not from Oregon. It's all over the world come to see this attraction. So we look forward to welcoming Dr. Campbell into our luncheon on March 9th and look forward to seeing you there. Now, our First Citizens banquet is upon us. That is Saturday, yes, Saturday, March 7th. And Laura Dorn has put together just an incredible committee that are making some special things happen. So without further ado, your winners are, just kidding. We have surprise videos are being filmed this week by our partners at Allied Video, and certainly want to recognize the Allied Video team for the great work they do here, along with CCTV, and making sure these forum luncheons can be publicized and on the internet and reproduced and viewed at later dates. But those videos are being filmed this week, and there's some very, very special people that are going to have some surprising moments. It is a can't-miss event, and there's a few things the committee have asked me to remind you. We're going to bring a dance floor back. So we are going to, at the end, create a little celebration. We'd like the floor to be filled. John and Betty Patacoli will be leading the way there. They do an incredible job of dancing and showing us what we all wish we could do. Patrick Lamb Band will be playing live throughout the banquet, and then the after-banquet post-game entertainment, as we'll call it, on the dance floor. And we have our MC that evening is Steve Dunn from KATU News. So make sure to grab your tickets for that. They are going quickly, and we do want to sell that out. If you'd connect with our chamber staff, we'd be happy to reserve your spot. I had already mentioned the great work that CCTV and Allied Video do for us. Thank you all for that work. And, of course, thank you to the staff here at the Salem Conference Center. They treat us very well, and I think we all appreciate the quality of meals we've gotten this entire forum season. Be looking forward to that. Anytime you walk into Columbia Bank, Key Bank, you are welcomed and engaged with a happy face. I would tell you that these two gentlemen to my left are equally engaging and welcoming, but for one of the most toughest challenges our community is facing. I had the opportunity, albeit briefly, to walk with both of these individuals. And the front line in Salem is a very interesting place. And if you haven't had the opportunity to volunteer some time, these two men would gladly accept an invitation for you to join them. And I'm going to be real honest. I had not seen methamphetamine smoked live in front of me before. It's a very interesting dynamic. But these two step up every day to take on issues like that and provide people who literally have no hope at all an avenue to communicate and start the first process. So if you can, rally around Be Bold Industries and know that these are two very special humans who have engaged on a very challenging career, and they need our support. Without the work of our ambassadors, who I feel really roll out our red carpet, our organization wouldn't be quite as special. May I ask our ambassadors to stand and be recognized for their work? Our chamber staff equally really should be engaging at all times, and somebody who's a resource to you. I want to thank our staff for the work they do to make this organization a place where everybody is included. And it doesn't matter what side of the political aisle you're on. If you are in favor of small business in this city, you have an organization that is your friend and stepping up for you each and every day. And I know this board of directors supports that and appreciates the support of our businesses. Now, at the end of the table is our most famous guest each and every month, and that is our new member bell. That bell rang 17 times in the month of January, which we're very proud of. And we would like to keep that ring going. So if you know a business that could benefit from getting into an organization that believes in all the right things and supports small businesses in this community so they can thrive, I'd like you to touch base with Zachary on our staff. Zachary Zalicki immediately engages. He just needs a lead. He is incredibly engaging with businesses and can show them why a Chamber of Commerce is important to be a member of in this community. And it's a heck of a lot of fun. If you haven't had the chance to swing the new member bell, please come up and do it. It's quite fun. Each month, our friends at Ross Fresh Markets offer us a beautiful bouquet that a season ticket holder can take home with them. Michael, Tim, and the entire Ross family are very committed to this community and know that you have a lot of choices when going out and purchasing your groceries and other things. And if you take a moment to always think, hey, how could I be supportive of a company like that? It's healthy. This month's winner, sometimes you give, sometimes you receive, is none other than our ambassador, Pam Fondrick. Pam, at the end, we'd welcome you to come up and grab a beautiful bouquet to take home and brighten up your office with your staff. A new addition is our friends over at Chinook Winds Resort, Casino, and Golf Course have offered us a new monthly package to give away, again to a season ticket holder. And I know that Barry and Casey, please wave. Thank you guys so much for your generosity. Let me tell you what this monthly package is. 1 night, overnight stay at Chinook Winds Casino and Hotel, tickets to 2 for entertainment event, and 2 complimentary meals. So this is quite a nice vacation away, less than an hour away, and great partners. And that will be going to another season ticket holder, Ted Ferry with State Farm Insurance. Oh, sitting at the same table even. Great networking. Super job. All right, wrapping up here. We have some wonderful young people with us today from McKay High School's MAPS Division Branch at McKay. Would you students mind standing so we can appreciate the work you're doing? Through a great partnership with MAPS Community Credit Union, a lot of young people are learning the ABCs of finance, and this is another great example of young people coming in, learning a little bit about what's going to be healthy in financing and the like. So MAPS, thank you so much. Our hats off to you for that commitment. I think I've done it all and wrapped up. I would close with this. With the dollars that Cheryl noted, and you look at the YMCA project and so many other builds that are occurring in this community with Arches and Union Gospel Mission, over $600 million of new investment in an annual cycle have been introduced into this community in the last 16 months. We ought to be very proud of that fact. Oftentimes, what's publicized the most is the negativity. This community is doing special things. All of you are the impetus and cause of that. So as a community, we need to be very proud of what's occurring, not only in our downtown, but across the entire Salem community. With that, go be great out there, and thank you so much for your attendance today.